in the early 60s, President John F. Kennedy signed an act which created services for people with mental illness in the community. And that was in fact the last act that he signed before he was assassinated. And that act funded services where people lived. The fact that that act was signed, along with the invention of other medications, newer medications, allowed people to come out of the shadows of institutionalization and into the community. And the funds from that act created the money that really established Mental Health America of Westmoreland County.
You had a long history there of those services where the focus was sending people to an institution for whatever disabilities or mental illnesses they had. And a lot of times isolated people, and that continued through the 1800s and early 1900s until it peaked somewhere in the 40s, the 1940s, where you had probably over 20 hospitals in the state of Pennsylvania, public hospitals, and you had probably 43,000 people. That was the peak. From there, it began to drop with deinstitutionalization and the services that I said before, the 66 Act, the Kennedy administration legislation, where you have people joining the boards of mental health associations, which are today Mental Health America, throughout the Commonwealth and throughout the United States, to advocate for community-based services that were appropriate and met the needs of individuals. So that movement continued, and my own history, being a CEO of one of the hospitals, Torrance, where I retired from, I also worked at Somerset State Hospital, Woodville State Hospital, Mayview State Hospital, and Harrisburg State Hospital. And throughout that time, we were going through a process where you had additional legislation through Medicare and Medicaid, demanding services, appropriate services, and we went through a large transition. But we depended on and we looked to the advocacy community to help us formalize those services, so to speak, in the sense of providing what was acceptable to individuals.
Years ago, my father-in-law, Fred Fineri Sr., was a founding father of mental health of Westmoreland County. He was instrumental in helping to lobby to get funds for a need that he felt that was here in the county. I was a young girl, I guess in the late 60s, early 70s, when I felt I needed something to do to help the community, to do something special. So I came to the Mental Health of America of Westmoreland County. We would meet with some of the people who were at Torrance State Hospital. We did programs with them in the YWCA, and this was so enriching. My husband, Fred Fineri, was an advocate also in Westmoreland County. And it's awesome to see, too, as the legacy lives on, that our children are also advocates for different organizations, that they also believe there is a need for advocacy.
One of the things that I think is compelling about Mental Health America in Westmoreland County is also the fact that we aligned with the national organization back in 2007, when National Mental Health Association decided to change their name to Mental Health America. We aligned with that. And when we became Mental Health America of Westmoreland County, I think that was a really profound moment for us, because it said in a very powerful way that mental health is important to each American. And what are we doing as a local community organization to make that known? And that for me was a really important moment in the life of our history.
I coordinate the satisfaction team. We survey individuals and family members of people that use the behavioral health system. And when I first started doing that, we would ask about, medication management. Is the doctor helping them get on medications to help them? Were they treated with respect and dignity? We still ask those things, but now we also ask recovery-oriented questions. We ask, Does your provider have recovery-oriented services? Do they encourage you to do things that are meaningful to you? Do they involve people who are important to you? And it's just a really different shift.
Consumer satisfaction teams independently survey our patients to ask them about our performance, and MHA shares those results with us. Together we become very much a team that looks at those results in a way that allows us to better our care. It is a way to support the organization, but it's also really important as a provider in the community to make a presence for organizations that advocate for the mentally ill.
With their own treatment, they have an expectation that they have a say. They have an expectation. They used to complain that the doctor wouldn't listen to them, but we don't get that complaint anymore. It's really been a shift. The Lost Group started in 2007 by MHA employee Jill Kowaleski and Laurie Barnett-Levine, the executive director, and they saw there wasn't a survivor group like that in Westmoreland County at the time. You had to go into Oakland to go to a group like that. So they started that, and then I got involved soon after because I'm a suicide survivor also. 20 years ago, my husband took his life. So it's important to us to provide that place for people to go and feel like they're not alone, and give them a safe place that they can start to heal, a place where they can vent, they can keep asking why, they can express all the feelings they have of anger and guilt and regret, and not be limited to a time frame. A lot of times people on the outside will be saying, well, it's been 6 months, aren't you over this yet? And it doesn't happen that fast, so they can stay as long as they want to, coming to the group to help them heal. And over the years, we have seen people really make it's really made a difference, because sometimes people come in, they can't really even talk at first. They're crying the whole time, and then after a while you start to see them smile, and then you start to see them laugh, and they can start to remember their loved one with happiness and remember the happy memories, and not just remember that they died in the way they did.
I guess I'd also say that innovations is a powerful way that we come together each year as an agency. We celebrate the good work that's going on in the community. We bring together about 200 people at that event each year. We celebrate people who are doing the good work, people who are promoting recovery, educating, advocating for mental health and wellness. All of the people, the organizations, the workplaces who are helping to reduce stigma and make mental health awareness and make an attention on recovery more of what is important to our world today.
There's a term that's used in the mental health community called recovery, and that means that you might not actually be cured of this illness that you have, but you can learn to live a rich and full life in the community despite having an illness. And each person's goal for recovery is individualized depending upon where that person is at. But it doesn't mean that having a mental illness is a life sentence. It doesn't mean that someone who has a mental illness is dangerous or they're going to hurt someone. The research also shows that people who have a mental illness are no more likely to commit a violent act than the general population. In fact, people who have a mental illness are more often likely to be victims rather than the victimizers. And it's important to continue to get this message across. I think, unfortunately, we have a long way to go.
Their mission of recovery is an important mission not only for the MHA, but for the acceptance and awareness of mental health issues in general.
I think they do a wonderful job, and I was really excited once I got on the board to hear of some of the successes that they had, and the continuing they continue to strive to meet those needs and to work to get community programs developed where they're needed for the people that need them most.
There's really not a day that goes by where Mental Health America isn't helping someone secure the assistance that they need. The staff is incredible. We have a group of people who are so deeply committed to making sure that people are helped. And whether that's a phone call during work hours or after work hours.
The Fineri family is proud to continue the legacy and to continue the good work that Mental Health America of Westmoreland County does.
I'm so proud of the legacy that this agency has from its founding years, 50 years ago. People and families who have been genuinely dedicated to the cause of improving people's mental health. Mental Health America isn't just about mental illness, it's also about mental wellness. I have felt so blessed in this position of executive director to have met so many people in the community, as well as board members and volunteers and staff who are so dedicated to the cause of treating people with mental illness and working towards recovery to mental wellness. The board and staff and volunteers are extremely dedicated, and this is what is helping us move forward into the future, into a future of hope, a future of resiliency, and a future of understanding.